It has been so long, 2 full months since I've hopped on or even did a blog post. I just need to disconnect a little bit when it came to talking about my journey and my story because I just needed to process and continue to process and kind of enjoy the summer, which I definitely did do, and it was amazing. So happy fall and happy full moon. I'm looking out my window right now and the moon is out of control. It is so gorgeous. It is a full moon tonight. Tonight's Sunday, and it is in Aries, which is my sign. So it's a very fiery moon that has a lot of meaning to it. So if you follow anything to do with astrology and the moon, please go look up what this moon means. I'm not going to get into it, but it's a powerful one. And I thought tonight was a good night to just share my feelings and my thoughts and introduce you to Paisley. This is her. As you can see, I know that I have done a post kind of introducing her to the world and letting her know that she's my puppy now, and she joined me and Buddy and our family, and we're a party of 3, and I'm sitting on the floor because she loves when I sit on the floor with her. And she has been a handful, and I am so in love with this little animal. She has given me so much love the last 3 weeks. I got her 3 weeks ago exactly today, and I love her so much. She's 14 weeks, and she is a baby hyena. Look at her. Look at this little hyena. And she was a gift. I go drumming once a month, and I go to my therapy sessions at Slow Medicine Sunraven in Bedford, New York, which I just love. Michael Finkelstein and Robin Finkelstein, and they are wellness practitioners, and their dog had puppies, and this is one of those puppies, and she was the last one left, and they were kind of like, you should take her. And I said yes. And trust me, there's been some days in the last 3 weeks where I wanted to give her back, but I'm not going to. So that is not what I'm here to talk about though, but Paisley will probably stay for most of this because she likes to chew on my fingers and sit on my lap. And Buddy is hiding because he tries to avoid her a little bit, but he does love her. When she's sleeping, he really loves her. So it's Breast Cancer Awareness Month, and that has been an interesting emotional trigger for me. The last few weeks I've had to attend a few events and be supportive, and over the past few years I've obviously gone to events and, drank the pink drinks and donated money to the auctions and done all the things that go along, got dressed up in pink outfits. And this year it kind of felt disconnected from all of that, and I wasn't interested. Even though I was there, I kind of just went through the motions, and it hit a little bit too close to home for me this time, because in my situation, everyone knows that I'm doing things a lot differently than the typical cancer patient, which is absolutely fine, and I'm not here to tell anyone what they need to do. I am just here to share my experiences and my journey and what that means for me. And for me, going to these events and hearing other people's experiences and the way that they go through traditional treatment and what that looks like for them and what people are raising money for and like how they're getting dressed up and the drinks and the food and the sugary cocktails just do not resonate with me for 1 second. So I have had a hard few weeks dealing with that and like getting through the days and then coming home and literally crying because of it. Because it's just been like, holy moly, I have been diagnosed with breast cancer, and for the last 10 months, it's 10 months. This weekend is 10 months that I was diagnosed, and I'm still here, excited and healthier than ever. And I had some really great scans last week, and I have more scans this week that showed a direction of which and where I should be going, and that's why I wanted to be on here today to share with you. But I just wanted everyone to recognize, these events are really amazing, and I understand that they do so much for these organizations and these charities, but they feel different to everybody that attends, and for me, they haven't felt so good or uplifting. They've actually depleted me and sucked energy from me. So I know that I I need to distance myself from these experiences and scenarios and kind of go inward. And I have done that. These last few months, weeks, I guess not months, but weeks, I've gone a little bit more inward, and I've been spending more time with myself, and I really am so happy it's fall. The summer, I really let loose a little bit, and I spent time with girlfriends, and we went out, and we enjoyed ourselves, and enjoyed the sunshine and the water and all the good things. And now I'm really ready to hunker in and do more of the work. And I'm really, really grateful for that realization and the time. So I wanted to say that. Also, I wanted to say, I'll get to the meat of it right now. I had an ultrasound with Dr. Z on Monday, and Dr. Z is my regular oncologist. I have my integrative oncologist, who's Dr. Witten. I have a specialist in Philadelphia, who is Dr. Mark Schwartz, and I have vitamin C treatment center that I go to, which is in Greenwich, Connecticut, and one in Scarsdale, New York. So they are both integrative wellness centers that distribute vitamin C treatments at high doses to allow oxidization of my cells and allow antioxidants to kind of like filter through to reduce inflammation in my body and in my cells, because cancer is, or any kind of disease is, inflammation in your body. And when there's strain on your body and inflammation from diet, stress, any of those triggers, there's reason for disease. So these things kind of help supplement that. And I have Dr. Z. I had Dr. Z on Monday, and he is wonderful, and he's a regular oncologist at Norwalk Cancer Institute at a Sloan Kettering, and he does not agree with me, but he monitors me and he loves me, and he tells me all of the risks, which I understand, and it's 10 months now, so no one is going to change my heart or my mind, and I'm going to find my way on myself like I just have been all this time. So we did my scan, and we got some great news. The tumor is still local. It's still basically the same size. It hasn't changed much since May, which is great, other than it's actually capsulated itself. It's created a container within itself, like a shell. So there's less fluid or necrotic tissue around the tumor, and it is more dense, like kind of like a hard-boiled egg with like fluid juicing through it, which shows that it is still alive and things are going on. But that's really good news. And the reason being is it hasn't spread. From what the tests that I've had, it's not in my lymph nodes. It's not in any surrounding area. It's literally still right here in the spot, and I feel it. I see it. I can see it through my skin a little bit, especially since I've lost weight and the days that I have major stress. It really shows itself, and I have to pay attention to that. Like when I'm on my feet for too long or I'm working for too long, my body does get very tired and the area inflames, and that causes some worry within me, which I have to meditate on and think through and feel and rest through those times. And I'm changing a lot. I've changed so much over the last 10 months, and the growth I am so grateful for. I am really so grateful for this journey. I know a lot of people use the hashtag fuck cancer. That is not me. I am a cancer thriver. I love that this happened to me for the reason that it's happening for me, and I really truly believe it has been a gift, because I have become such a better person and been able to handle this journey with such grace and advocate for myself. I am really advocating. Just because the doctors have told me what they think is right for me, it is not what's right for me. And I felt that the whole entire time. And I've stayed true to myself. And yes, the cancer is still here, but there's hope at the end of this tunnel, because I am still healthy, it hasn't spread, all is well, and I'm still here. So what I do want to say is, under advisement, I said in one of my last videos 10 weeks ago that I was under advisement from my integrative oncologist to go back to my regular oncologist to kind of talk about options to see more and do more tests. And with that said, we decided, all of us, my whole team has decided that it is time to potentially remove the tumor. So in March, I did have surgery scheduled when I was diagnosed, and then I canceled that surgery for all of my other findings and research I did of like the type of cancer I have and the possibility of metastasizing through surgery, especially without any of the traditional treatments and all the risks that they were. So I had opted out for surgery in hopes that I would be able to reduce the size of the tumor myself. I have this light and Paisley keeps hitting it because she likes to touch everything. So I lost my thought, but I'm not, it's 10 minutes in, so we're going to keep going here. So with surgery, so it's under advisement that now it could potentially be time because of the way that the tumor has capsulated itself in this like kind of safe egg shape, with this hard shell. It might be time to remove it. So the goal was to find a surgeon who would do this because the recommendation is obviously double mastectomy because I'm BRCA positive. I've said this 100 times in all of my stuff. Double mastectomy, ovary removal, chemotherapy, and potentially radiation. Not happening. So the reason that those things are not happening is I have this idea and this intuitive knowledge inside me that I know that I'm going to use my body in a really beneficial divine way that it's meant to be used for. So I am not willing to jeopardize all of my makeup and my future for what is recommended. But Dr. Z recommended me to a surgeon. Her name is Helen Pass. She is in Stamford, Connecticut, right here where I live. And I met with her on Wednesday after the ultrasound, and she was absolutely amazing. She's super knowledgeable when it comes to the integrative stuff, and she sat with me and spoke to me like a human being. She brought me into her office. She gave me a hug. We talked for 2 hours. She told me she was not going to try to change my mind, as she could tell that I was very well read and knowledgeable in my type of cancer and obviously in the knowledge of what my body needs. So instead, she just went through all of the risk factors and all of the possibilities that we could go through. And at the end of the day, we have decided that it's time for the tumor to go. So Patience is her name, and that's what I've been referring to as this whole time throughout this journey is Patience, which is my cancer, is I am definitely open to the possibility of removing her. And Dr. Helen Pass has agreed to do just a lumpectomy and leave the rest of my breast intact so that I have full function of my nipple and my milk ducts and all those things that I hope to be able to use them for one day. So that is great news. I am so excited. So surgery is scheduled. We have a date that we are looking at, and it's coming up real soon in the next 3 weeks, and she can do it, and I'm so grateful to her. So with that, this journey does not end. We will have to do more tests when the lump comes out. We are not going to remove any lymph nodes. We agreed that removing my lymph nodes, sentinel and otherwise, will compromise my immune system, and that is not what we can do. She does believe that with all of the things and the modalities that I'm using to heal my body will be able to heal any cancer cells, if any are left behind, because they will be microscopic. And she does believe that she can remove the entire mass as a whole and leave my breast intact and leave me potentially cancer-free. So with that being said, oh my gosh, I can't even tell you the emotion that comes with that, because obviously I would prefer not to have surgery, and I would have preferred to be able to do this whole thing holistically, completely. And my body is telling me right now that maybe it is time. It can do all the work. It has been doing the work, but it is time to take away the strain so that my body can continue to heal the way that it needs to. This is going to be forever work. This doesn't just end when I have surgery. It doesn't end. I will continue to green juice. I will continue not to consume sugar. I will have minimal alcohol in my diet. I'm not gonna lie, this summer I had a couple of tequilas on the rocks because, trust me, I needed them, and they did not affect my body in any way, which felt great. I did actually start incorporating red meat back into my diet, so I am having some grass-fed red meat here and there, which helps with my iron and my iodine and so many vitamin D, which I have been deficient in. So it's been amazing. So all of this journey has taught me so much. But I will still need to do my vitamin C treatments. I will still need to go to my infrared saunas and detox. I will still need to green juice. I have been doing coffee enemas. That's a whole nother video that I can't wait to share with you, because holy cow, if you don't know what a coffee enema is, look it up. It is so good for you. I feel so good after. It's super cleansing for the liver. It detoxes the liver. It affects the kidney in really good ways, and it helps the liver filter the blood the way that it's supposed to. Our body is a well-oiled machine if we do everything we're supposed to do to treat it right. And I really encourage anyone out there who is having a hard time, or any pain or inflammation or digestive issues or cancer or diabetes or anything that you may have, to really look at what you're consuming and the stress that's in your life and what you're doing, the choices that you're making, because you have the power. I am proof. We have the power to change, and it doesn't have to be a traditional way. It can be absolutely untraditional if you have the knowledge and the power. So empower yourselves. That's all I ask. So with that said, I also have been humbled and want to thank everyone so deeply from the bottom of my heart, because in 10 weeks since I put up my GoFundMe, you have helped me raise $10,000 almost. I'm at like $9,300. And that has really helped me the last few months really get the treatments that I need. My vitamin C's cost so much. They're like $400 weekly. My acupuncture, my healing oasis for my infrared saunas, yoga, the therapy, all the things I've been doing. Everyone that is my practitioners have been so great and have really stepped up and given me a lot of deals and been so loving towards me, because they really want to see me succeed. And I've been so grateful for that. But these doctor's appointments cost me so much money, and I know I choose to live in America, and I am Canadian, and regardless the modalities that I'm using, and that has been part of the frustration for me, is that I've been such an advocate for myself, and I've been learning these things all by myself and doing the research all by myself of what these modalities mean, searching out these doctors that are aligned with me and my mission and believe in me and who I am. And all of these things unfortunately cost so much money. And last week I had an appointment that was $1,300, and I had to pay that out of pocket. So the GoFundMe has really helped, and I just want to thank you from the bottom of my heart. And if you haven't donated, please donate. Please take $20 or whatever you can and throw it into the pot for me to help me continue to heal, because it means the world, and you're part of this with me. And I just can't thank you enough for that. So if you feel inclined and you haven't donated yet, please donate, because I have more doctor's appointments coming up. I have more bills. Last week was pretty amazing. Someone I don't even know heard my story and put a check in the mail, and the check was able to cover that $1,300 appointment and my vitamin C that week, and it was enough to get me through that time. And it was someone I didn't even know. And there's people that I know who haven't even donated yet. So I would love for you to donate and believe in me and show me that you believe in me. It would just mean the world. So thank you. So off that, and next steps, we talked about surgery. I also wanted to talk about prevention. Yes, it's Breast Cancer Awareness Month, and if you haven't got your mammogram or gotten an ultrasound or done even just your regular feel around and your manual massage to your breast to see if you feel something, do it. Do not waste any time. I am stage 2. I found my tumor last November, and in January I was diagnosed, and I am stage 2 still, which is incredible because with my type of cancer, if someone were to do nothing, they would be stage 4. So I've been able to maintain and contain my cancer just the way it is and maintain it as stage 2. So find it early. If you have any fear at all around it, just dive into the fear and figure it out, because this is your life and it's my life and we're in this together. So please, please, please. And if you have any questions, write me, let me know. I'm happy to help or direct you in any way. Food, diet, massaging, coffee enemas, vitamin C treatments, you name it. I have all the info in my head and in all of my journals, which is crazy. I know, I'm a party foul here. Okay, so a couple things coming up that I'm so excited about. 2 things to be exact is I am speaking at a conference that I'm really excited about. I was asked to speak at an integrative wellness conference on October 27th on a panel of cancer thrivers. And that's the other thing. I don't want to be a cancer survivor. I want to be a thriver, and I want to continue to thrive in my life in every single aspect and really get to the place where I am at my fullest potential and my fullest power. And I believe that I am getting there, and I am starting to attract all of that goodness right into my life, and it's falling right into place. So I am super duper excited to be speaking at this. The link is in the blog, so please check it out. It's really affordable to attend. It's a full day of speakers, doctors, and panelists who have all been doing this the integrative way. It is so much information. So if you're in the area and you see this, it's on October 27th, 8 a.m. till 5 p.m. It is an integrative wellness conference, and it's here in Greenwich, Connecticut. So I am going to put all the info is up there. So just click on the link, read the blog, and buy your ticket. Thank you. And I've also been doing some work on my inner child work, which I've been saying. So, you know, I am a very independent person. I always have been. A lot of things have come up for me all through this journey, and I have felt lonely at times as I'm going through this, because not everyone understands this. Yes, I have an amazing support system with all my friends and my loved ones. I know that this video is long, so thank you for being so patient. So all of my friends have been amazing, but I felt a little bit lonely. I haven't felt completely supported in all aspects, and those are things that I needed to dive into and find the inner love for myself and understand that not everyone can give me the things that I want, especially the people that say that they love me. So I'm learning how to handle that, and I'm learning how to not internalize and feel that from an inner child place, like as the little girl who just craves the love from the people who are supposed to love her most. And I am learning how to love myself enough that none of that other stuff really matters. And it has actually felt lighter and really good, and I'm working on all of my relationships in a really positive way. And I really encourage anybody who has any holdups or things that are holding them back, or emotional triggers or patterns that you keep looping, to really look at the inner child stuff and see where that comes from, because it has helped me tremendously. I'm also doing a course right now with Dr. Joe Dispenza. If you don't know who he is, he wrote the best-selling book called Becoming Supernatural. He has been on the documentary Heal on Netflix. He has also been on What the Bleep. He is amazing, and it's all about mindset and the power of your mind and meditation, and the way that you can actually rebuild and change your cellular makeup and your genetic makeup within your body, and basically create a whole new perspective inside yourself. And I have really loved his courses. And one thing that he says about meditation that really hits home for me is reconditioning your mind to create a new body. So, you know, we get stuck in the old ways of thinking all of the time. And what this journey has taught me is that if you just change a little bit, you can change everything. And not only has my body changed, like physically, I'm in the best shape of my entire life. I'm at my optimal weight for my height. I go to yoga and I feel so strong. I'm at yoga all the time. CT Power Yoga. I love you, Amy. Amy is also a breast cancer thriver, and she is amazing. And she opened a yoga studio years ago, and I love her story too. And she's opened her doors to me, and I just am so thankful. And I have been stronger because of it. So I really, really, really encourage you to make one little change in your life to just better yourself and help you create a new body and recondition your mind to be your fullest potential, because we're all here for a really big reason. So I think that covers it. I know that was a lot, 25 minutes later, and I hope that that gave you some insight, and thank you so much again for all your support and your love all the time. I know that my life looks so fancy and perfect and awesome, but it is not. It is messy and weird and loud and quiet and sad at times and lonely. And your support just really means the world. And like I said, if you can contribute to my GoFundMe, please do. I have doctor's appointments this week, and unfortunately my work life does not accommodate for those things. It only accommodates for my living accommodations. So thank you again from the bottom of my heart. I hope you enjoy the blog. If you have any questions, let me know. I am here. I love answering. I love talking to you, and I really hope this empowers you in some way.